You know, I know Wes was going to bring back the family GP. I'm just worried he's going to have to bring us back from the dead at this rate.
Practice in England started keeping online booking appointments open throughout the day, not just for a few hours.
Well, the government said it would improve the system, but for some patients and GPs, it hasn't made things easier. Now, previously, many patients had to ring up their practice in the hope of getting an appointment to see a doctor. Yeah, I'm sure if you've been through it, you know why it's called the 8 a.m. scramble.
We've all done it, haven't we? The government says that when patients can't get through on the phone, 6.6% of them end up in A&E, going to hospital and clogging up A&E departments. That's worse for them, of course, and more expensive for the taxpayer.
So, it introduced changes in October. GPs now keep the online consultation tools running throughout the day, so patients can request appointments, ask questions and describe their symptoms, and they don't have to call their surgery or visit in person. Sounds simple, doesn't it?
Yeah, but the BMA, the British Medical Association, the Doctors' Union, is so worried about how the new system is working that it has opened a formal dispute with the government, saying that GPs will be overwhelmed with both non-urgent and urgent patient queries, and life-threatening issues could be missed or delayed.
Well, we're joined now on the sofa by Dr. Fari Ahmed.
Morning.
It sounded like this was going to be the end of people's frustrations. No more hanging on the phone for half an hour. But in fact, doctors are saying the opposite. It's actually causing them less time to actually see people.
Yes, it does. It does. You're right. It sounds like an amazing idea. The problem is there's not been many resources, so either in doctors or funding to support this. So if you have a sheet of cloth and then you have to now pull it to cover the online access, there's another bit that goes naked. You know, we're not able to cover everything. Some of the issues are, you know, it's supposed to be open for routine queries. Patients don't always realise what to them might feel routine actually is urgent. So we now have a doctor who's running through all of the queries up till 6:30 to make sure that actually there's nothing urgent that needs quick attention that is not going to be missed. I had a chat with another doctor a couple of days ago who said there was something that came through as a routine which was actually quite serious and needed an ambulance sending out to them. But if he hadn't been doing that patient could have been.
Well, that puts a lot of onus on you, doesn't it, to be able to read between the lines of how someone might have described what they've, and they may not be able to describe it as you would read it.
Yeah. And so you have to. So this is where knowing your patient is really important, and also knowing their medical history and being able to do that. So unfortunately, we don't have the resources for us to be able to do this as well as do everything else. So one of the things we're good at is looking after chronic disease. So we mind your blood pressure and your cholesterol so you don't have a heart attack and end up in the system. So we're pulling resources away from that. It's not safe for patients, and the problem is at the moment it's another pressure on primary care. We don't have enough GPs working. We do have lots of GPs who are unemployed, so there's a solution for you. And I train doctors. And what's really sad is I'm seeing all these really excellent trainees becoming GPs, but then they're struggling to find work. And actually, we have so many patients who would benefit from seeing their doctor.
The government's argued this is the right plan, it's got the right building blocks in place, and that, in fact, now more GP appointments are being booked. It says that's what the figures show. I mean, is the reality that with the 8 a.m. scramble, some people used to just give up, and so they never got their appointments, and now you are seeing perhaps a truer reflection of the number of people who really do need to see a doctor? Yeah,
so, you know, there are less and less of us GPs, so each GP is now looking after 300 or 400 more patients than we were a few years ago. Our funding...
So how many do you do, was an average GP have?
So an average GP was looking after about 1,700, 1,800 patients, and now we're looking after 2,300. Okay. So already the number of patients per GP has gone up. The funding, so our funding in real terms has dropped by about 20% since 2015. So we're really struggling. I know practices where they're actually having to consider making some of their staff redundant so they can manage this without it being a cost to them. GP practices are businesses, and we have one customer, the NHS. And if the NHS chooses how to pay us or to pay us less or to get us to do more, then we'll struggle to do it.
What's the solution? You know, because the BMA has said this is about patient safety. That's why it's putting it into dispute with the government. What do you want the government to do?
So I think there's been like some excellent reports. I think they were done by a cross-party report just a couple of years ago, and they put lots of time, thought into it, and they came up with sensible solutions, which now seems to be shelved and forgotten. So talk to us. We care about our patients. I want my patients to have timely access to the right people, and I want to be able to carry on doing it for the rest of my life and their life. But if we get these pressures that are not sustainable, you know, I know Wes was going to bring back the family GP. I'm just worried he's going to have to bring us back from the dead at this rate.
Yeah, some way to go to get the system right, isn't there? It's so frustrating for people.
Yeah.
Let me ask you a question about the flu.
Okay,
We're being told it's a horror season for the flu this winter, and that people are really being urged to get their vaccines.
Yeah.
Is that really going to make a difference for people? Some people say, look, we've had the jab, you still get the flu, you still feel pretty rotten.
Yeah. So our flu always copies the pattern we see in Australia. So we know this year they had it bad, so we know it's coming our way. We know people who've had the jab. I know sometimes you can still get the flu even if you've had the jab, but you don't get it as bad as if you hadn't had the jab at all. And every year the flu virus changes. So even if you had the jab last year, the new jab you have, we change it so that it'll be like able to be very effective against the flu virus we're facing this year. Get your jab. I know it sometimes feels like a pain, but it stops people being ill. It stops hospitals filling up. It stops all the pressure on the services that happens every winter.
Just very briefly, the criteria for people?
So if you're over 65, you're entitled to it. Pregnant women, children. So, and then the other people are people who've got health conditions, or if you're carers or in a nursing home. But most people should have some contact.
And it can kill you. That's the bottom line.
Oh, it certainly kills people every year. And the worry is this year it's going to do more.
Thank you very much for coming in. As always, we really appreciate it. Dr. Farriama, thank you.
Thank you. Had mine the other day.
Done.
Right.